GlobalHealth Education proudly introduces the Clinical Learning Cloud, a digital applied knowledge solution. Designed to test critical thinking skills in a clinical setting, the following simulation serves as the prototype capstone, working hand in hand with a sample course on the study of diabetes pharmacotherapy. Both were developed as part of a sample framework for standardizing pharmacy education, a framework which is competency-based, disease state-focused, and supplemental to university education. The framework offers both global scope and local specificity. This sample coursework was facilitated by educational experts from GlobalHealth Education. This sample simulation tests a practicing pharmacist's decision-making skills in a timed clinical setting in the treatment of diabetes. The Clinical Learning Cloud is not only web-based, but the software can be downloaded in minutes, allowing for both real-time and offline completion. It is database-driven to allow for user-friendly updates, as well as translation and acculturation. And the cloud houses multiple simulations integrated into each course and learning management system at the discretion of the faculty. Hand-picked subject matter experts lead the development of all courses and virtual assessments, creating a collaborative and dynamic learning platform. Adhering to academic best practices, both the course and simulation were designed around defined academic learning objectives and allow for measured learning outcomes. The course was developed leveraging eCollege's world-class learning management system used by universities worldwide. The course is a comprehensive study on the diabetes, the epidemic, its epidemiology, its pathophysiology, concomitant conditions, and the role of the pharmacist in a collaborative practice model as it applies to disease management. Faculty facilitated, the course employs multiple engagement classroom tools from live chat through threaded discussions and journaling. It lays the foundation for what's later assessed through the simulation. Faculty maintain a transparency and ability to interact throughout the simulation as well, and this allows faculty to provide additional positive and negative reinforcement in addition to those automated from the presenter and subject matter expert. Each simulation is comprised of various academic stages, is database-driven, timed, and randomized for the ultimate individual learning experience. The first two stages focus on testing to ascertain whether sufficient knowledge was gained through the course in order to move into the subsequent stages. Stages 3 onward present a patient case study as the basis through which diagnosis, treatment, and follow-up acumen are assessed. This particular simulation depicts the dynamic changes in a patient's condition and assessment of treatment options that are appropriate to stabilizing a patient with diabetes type 1 who is suffering from diabetic ketoacidosis. Through both the course and the simulation, the importance of understanding the collaborative practice model and the pharmacist's clinical leadership role is emphasized. And with that in mind, GlobalHealth Education welcomes you to our learning platform and invites you to step into our cloud.